Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is Nclex PN Review Lesson 13. We're going to be doing neurological disorder questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. The nurse is assisting with caring for a client after a craniotomy. Which is the best position for the client to be placed? A. Prone position. B. Supine position. C. Semi-Fowler's position. D. Dorsal recumbent position. The correct answer is C. Semi-Fowler's position. Rationale: after a craniotomy, the head of the bed is elevated 30 to 45 degrees, and the client's head is maintained in a midline, neutral position to facilitate venous drainage. Options A, B, and D are incorrect positions. Question 2. The nurse is caring for a client following a supratentorial craniotomy, in which a large tumor was removed from the left side. In which position can the nurse safely place the client? Refer to figures. A. Bed 1. B. Bed 2. C. Bed 3. D. Bed 4. The correct answer is A. Bed 1. Rationale: clients who have undergone supratentorial surgery should have the head of the bed elevated 30 degrees to promote venous drainage from the head. The client is positioned to avoid extreme hip or neck flexion, and the head is maintained in a midline neutral position. If a large tumor has been removed, the client should be placed on the non-operative side to prevent displacement of the cranial contents. A flat position or Trendelenburg's position would increase intracranial pressure. A reverse Trendelenburg's position would not be helpful and may be uncomfortable for the client. Question 3. A client with a seizure disorder is being admitted to the hospital. Which should the nurse plan to implement for this client? Select all that apply. A. Pad the bedside rails. B. Place an airway at the bedside. C. Place oxygen equipment at the bedside. D. Place suction equipment at the bedside. E. Tape a padded tongue blade to the wall at the head of the bed. The correct answers are A. Pad the bedside rails, B. Place an airway at the bedside, C. Place oxygen equipment at the bedside, and D. Place suction equipment at the bedside. Rationale: the nurse should plan seizure precautions for a client with a seizure disorder. The precautions include padded side rails and an airway and oxygen and suction equipment at the bedside. Attempts to force a padded tongue blade between clenched teeth may result in injury to the teeth and mouth. Therefore, a padded tongue blade is not placed at the bedside. Question 4. The nurse is caring for a client with increased intracranial pressure. Which change in vital signs would occur if the intracranial pressure is rising? A. Increasing temperature, increasing pulse, increasing respirations, decreasing blood pressure. B. Decreasing temperature, decreasing pulse, increasing respirations, decreasing blood pressure. C. Decreasing temperature, increasing pulse, decreasing respirations, increasing blood pressure. D. Increasing temperature, decreasing pulse, decreasing respirations, increasing blood pressure. The correct answer is D. Increasing temperature, decreasing pulse, decreasing respirations, increasing blood pressure. Rationale: a change in vital signs may be a late sign of increased intracranial pressure. Trends include increasing temperature and blood pressure and decreasing pulse and respirations. Respiratory irregularities may also arise. Question 5. The nurse observes the unlicensed assistive personnel positioning the client with increased intracranial pressure. Which position would require intervention by the nurse? A. Head midline. B. Head turned to the side. C. Neck in neutral position. D. Head of bed elevated 30 to 45 degrees. The correct answer is B. Head turned to the side. Rationale: the head of the client with increased ICP should be positioned so that the head is in a neutral, midline position. The nurse should avoid flexing, or extending the neck, or turning the head side to side. The head of the bed should be raised to 30 to 45 degrees. Use of proper positions promotes venous drainage from the cranium to keep ICP down. Question 6. The client recovering from a head injury is arousable and participating in care. The nurse determines that the client understands measures to prevent elevations in intracranial pressure if the nurse observes the client doing which activity? A. Blowing the nose. B. Isometric exercises. C. Coughing vigorously. D. Exhaling during repositioning. The correct answer is D. Exhaling during repositioning. Rationale: activities that increase intrathoracic and intraabdominal pressures cause indirect elevation of the ICP. Some of these activities include isometric exercises, Valsalva maneuver, coughing, sneezing, and blowing the nose. Exhaling during activities such as repositioning or pulling up in bed opens the glottis, which prevents intrathoracic pressure from rising. Question 7. The client has clear fluid leaking from the nose after a basilar skull fracture. The nurse determines that this is cerebrospinal fluid if the fluid meets which criteria? A. Is grossly bloody in appearance and has a pH of 6. B. Clumps together on the dressing and has a pH of 7. C. Is clear in appearance and tests negative for glucose. D. Separates into concentric rings and tests positive for glucose. The correct answer is D. Separates into concentric rings and tests positive for glucose. Rationale: leakage of cerebrospinal fluid from the ears or nose may accompany basilar skull fracture. It can be distinguished from other body fluids because the drainage will separate into bloody and yellow concentric rings on dressing material, which is known as the halo sign. It also tests positive for glucose. Options A, B, and C are not characteristics of cerebrospinal fluid. Question 8. The client is admitted to the hospital for observation with a probable minor head injury after an automobile crash. The nurse expects the cervical collar will remain in place until which time? A. The client is taken for spinal X-rays. B. The family comes to visit after surgery. C. The nurse needs to provide physical care. D. The healthcare provider reviews the X-ray results. The correct answer is D. The healthcare provider reviews the X-ray results. Rationale: there is a significant association between cervical spine injury and head injury. For this reason, the nurse leaves any form of spinal immobilization in place until lateral cervical spine X-rays rule out fracture or other damage, and the results have been reviewed by the healthcare provider. Question 9. The client was seen and treated in the emergency department for a concussion. Before discharge, the nurse explains the signs/symptoms of a worsening condition. The nurse determines that the family needs further teaching if they state they will return to the emergency department if the client experiences which sign/symptom? A. Vomiting. B. Minor headache. C. Difficulty speaking. D. Difficulty awakening. The correct answer is B. Minor headache. Rationale: a concussion after head injury is a temporary loss of consciousness without evidence of structural damage. After concussion, the family is taught to monitor the client and call the healthcare provider, or return the client to the emergency department if certain signs and symptoms are noted. These include confusion, difficulty awakening or speaking, one-sided weakness, vomiting, or severe headache. Minor headache is expected. Question 10. The nurse is caring for a client who has undergone craniotomy with a supratentorial incision. The nurse should plan to place the client in which position postoperatively? A. Head of bed flat, head and neck midline. B. Head of bed flat, head turned to the non-operative side. C. Head of bed elevated 30 to 45 degrees, head and neck midline. D. Head of bed elevated 30 to 45 degrees, head turned to the operative side. The correct answer is C. Head of bed elevated 30 to 45 degrees, head and neck midline. Rationale: following supratentorial surgery, the head of the bed is kept at a 30 to 45 degree angle. The head and neck should not be angled either anteriorly or laterally, but rather should be kept in a neutral position. This will promote venous return through the jugular veins, which will help prevent a rise in intracranial pressure.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.